Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
Welcome back to another episode of Superhuman Radio. Now we bring my guest on today, and he is Dr. Michael Lisanti. How you doing, Dr. Lisanti?
Good.
And I'm going to give you a little information about Dr. Lisanti. He began his education at NYU, graduated magna cum laude in chemistry. He obtained an MD and a PhD degree at Cornell University Medical College in cellular biology and genetics. He's also a fellow of the Whitehead Institute at MIT. After, let's see, what else? He was at Albert Einstein School of College of Medicine. And now you are actually the chairperson in translational medicine at the University of Salford in Manchester. Is that correct? Did I get it right?
That's absolutely right. Yep.
Dude, when do you sleep? I mean, really, that's amazing.
I sleep very well 8 hours a day. So,
yeah,
I'm actually always energetic, always thinking about anti-aging, anti-cancer cures. So it keeps me going, keeps us all going.
Inquisitiveness. That's a wonderful gift. It really is. So let's talk about this. Why this study on looking at senolytics as a treatment or prevention for coronavirus? What research was done before this that kind of gave you a glimpse like we should look at this?
Well, we actually identified azithromycin as a new senolytic drug. And what we saw is that it selectively targets senescent cells with an efficiency of 97%. We published that in 2018. And if you go back in the literature, you can see that also the drug was used to treat patients with cystic fibrosis. Mm-hmm. And it dramatically extended their lifespan. And it did that by preventing the inflammation and fibrosis that is characteristic of the disease. And also it's been shown that azithromycin can extend lifespan and survival in patients with idiopathic pulmonary fibrosis, or IPF. So it's actually a very under-recognized anti-fibrotic, anti-inflammatory drug. It inhibits the production of IL-6. It reduces fibrosis. And if you look in the literature, it's also been shown to inhibit viral replication. Now, the reason that all those things come together is they all require protein synthesis. You need protein synthesis to make IL-6. You need protein synthesis to make collagen for the fibrosis. And you need protein synthesis for the virus to replicate. So this drug actually would be ideal potentially for treating patients with COVID-19. And in fact, that would explain why the French had such good luck with the combination between hydroxychloroquine and azithromycin. But surprisingly, they didn't test azithromycin alone. I think potentially azithromycin alone would be actually sufficient. And you could think of the COVID-19 almost like a very acute case of cystic fibrosis in the sense that it creates this very acute inflammation, huge levels of IL-6, which other groups have shown is a predictor for being intubated and put on a respirator in the case of COVID-19. So anything you could do to reduce the inflammation and fibrosis would be something that you could prevent the disease becoming very acute and deadly. So I think, the French clinical trials are right on target with using azithromycin. But there are other drugs also like rapamycin and also doxycycline, which are both anti-aging drugs. And they both also behave as inhibitors of protein synthesis. Both reduce IL-6 and both also reduce fibrosis, and they also reduce viral replication. So I don't know why people aren't trialing these, but they should be.
I agree. Now, azithromycin falls into the class of drugs as an antibiotic, correct?
Yes, also doxycycline, and I think
Yeah.
rapamycin is also considered, or was originally considered, an antibiotic because the name rapamycin is really the same name you would give to an antibiotic, the mycin.
Mycin, right. Right. And that makes sense because it was used as an anti-rejection drug. So that makes a lot of sense. Now, you're not a fan for turning off mTOR all the time, right? Yeah, mTOR. So you're not a fan of mTOR inhibition continuously around the clock, right? You're for it for short periods of time to do a job, right?
Well, I think what you need is intermittent because you also need protein synthesis to maintain your body.
Yes.
And also for repair, wound healing, etc. So you can't shut it off forever.
Right, exactly. I'm glad to hear you say that because a lot of people out there that are talking about shutting it off forever in an effort to live longer. So now that means drugs or molecules like quercetin, resveratrol, even dasatinib, which was originally a chemo, they all have found their way into the realm of being senolytics. Would these also be effective?
I think anything that would inhibit protein synthesis would probably be effective. And there's good evidence in the literature that different drugs that inhibit protein synthesis also inhibit viral replication. So I think any one of them individually would be sufficient for both treatment and prophylaxis. It's just a question of getting those drugs trialed. There's been anecdotal evidence, I think, but it depends on the toxicity of the drug. Doxycycline is actually not very toxic. It's used for acne worldwide. It's one of the number one drugs prescribed worldwide. Azithromycin is also considered a very safe drug. So I think both of them individually would be potentially sufficient.
Now, for treating someone who has the virus and is displaying the symptoms, because usually we get azithromycin in like a 5-day, hammer. You take a Z-Pack, 5 days or 6 days and you're done. Would you give the same doses for longer periods of time until the patient was out of the woods, or would you approach it differently, you think?
I think the regular dose of azithromycin should be sufficient. And we've seen that in time-lapse photography of the cells in culture, that it only takes 5 hours for the azithromycin to kill all of the senescent cells, nearly all of them. So I think a regular dose of Z-Pack should be fine. Obviously, you need to talk to your doctor and see if you can find somebody who's sympathetic. But it may not be well known, but in the United States, 25% of all prescriptions are called off-label. That means for another use. So it's perfectly legal in the United States to prescribe an FDA-approved drug for another use. So any doctor could prescribe any FDA-approved drug for any use. So I think that gives people in the U.S. a wide latitude. That's not true in the UK and Europe, but in the United States, there's wide latitude. And I think that helps people identify and repurpose FDA-approved drugs. If they have a hunch and they see that there's an anecdotal effect, then they can put that drug into a clinical trial and ultimately get FDA approval for that indication.
So do you really think the mechanism of action here is the eradication of senescent cells? And the only reason why I ask that, and the reduction of protein synthesis, because I'm sure you saw a study that was published earlier this year or late last year that showed that a single bout of resistance training eliminated 60% of senescent cells in muscle tissue. But we have to understand that that also triggers an increase in mTOR following that exercise routine. So is it possible that it's just about eliminating senescent cells and not turning off mTOR?
I think, there's plus and minuses to both approaches, but I think that, if you look at the literature on azithromycin, they've done experiments in mice and they've used bleomycin to induce fibrosis. Bleomycin is an anti-cancer drug, and one of its major side effects is lung fibrosis. But if they give it in combination with azithromycin or shortly afterwards, then there's no fibrosis. And that's because there are cells that generate the fibrotic material, the collagen. They're called myofibroblasts. And if you look at the published studies in our work, you can see that azithromycin eliminates all the myofibroblasts. So essentially, it's an antifibrotic. That has wide implications potentially for many other fibrotic diseases. The number one fibrotic disease actually is post-op adhesions. A lot of people who have surgery develop fibrosis in their abdomen, and that can lead to torsion and obstruction of the bowel. So, and also there is scar tissue, from surgery on the skin. So that forms keloids. So potentially also, azithromycin may have a role there in removing fibrotic tissue, both internally and also on the skin. So I think all of this is related, again, to senescence and myofibroblasts.
Okay, so senescent cells accumulate in our bodies over time. Is there a linkage to blood sugar management and the synthesis of senescent cells?
I think, we're still in the infancy of understanding metabolism and senescence, because it may be different in different cell types. And when people talk about senescence in normal cells is more or less associated with an energy deficit. But those senescent cells still have to produce an awful lot of protein because they have the senescence-associated secretory phenotype, which requires a lot of energy to synthesize the inflammatory mediators. Whereas also in cancer cells, when they become senescent, they have a different metabolic phenotype, I believe, where there's potentially increased mitochondrial activity. So I think it depends on the cell type. What we're really talking about is, I think, the senescent fibroblasts, where there's an energy deficit, but they may be more glycolytic, but also that may be associated with the inflammatory phenotype. So it's really that inflammatory phenotype which is so deadly, and that production of the IL-6 is also almost contagious, because IL-6 is an inflammatory mediator that is secreted, and so then it makes the other surrounding cells also senescent. So it's almost like an infectious disease where senescence spreads from one part of the body to the other based on the secretion of IL-6. So we really need to take IL-6 out of the equation, and azithromycin and doxycycline have both been shown to inhibit protein synthesis and IL-6 production. So either one of them would be a way to control IL-6 levels, to reduce IL-6 levels.
Is it practical to think of those, if a doctor wanted to prescribe them, as a prophylactic, to take those? You don't have the virus now. You're living in Westchester, someplace like that. And you're like, I don't want to get the virus, doc. And he goes, well, we'll put you on zithromycin for a low dose every day, or just one time, a Z-Pack, and you're good for a month or two. Any ideas?
I guess, for the prophylaxis, could be done weekly. Obviously, it would have to be done under the supervision of your doctor, but people have shown that azithromycin inhibits viral replication of Zika virus and also Ebola virus. So it's not specific to a particular virus. It's because it's inhibiting protein synthesis. And also doxycycline has been shown to inhibit replication of the dengue virus.
Another retrovirus.
Has been shown to inhibit the replication of the HIV virus. All, we think, because of the inhibition of protein synthesis. So, and viruses are just either RNA or DNA in a protein coat. And without that protein coat, they can't leave the cell and they can't become infectious. So without protein synthesis, you cannot make a live virus. So if you can inhibit protein synthesis, you can block viral replication. And that's what we would need here as prophylaxis, and also for therapy, because then you prevent the transmission internally of the virus from one cell to the other. So you would sort of nip the infection in the bud, and you wouldn't get the fibrosis or inflammation. So, in azithromycin, you have a drug that would inhibit both inflammation, fibrosis, and viral replication. What more could you ask for?
It's very exciting. I know. I mean, so I'm assuming that this fibrotic tissue that builds up from a variety of things. I mean, we have people who have failing kidneys because the what do they call the glomerular filtration rate slows down because the kidney becomes fibrotic. And so there's lots of talk about how do you treat that. And most people who have fibrotic kidneys, they're told, that's it. It's just a slow. I mean, couldn't azithromycin be used even in that type of an instance, you think?
Exactly. It should remove fibrosis and prevent fibrosis systemically. And this would have a ton of benefits. Also, fibrosis is associated with aging. So we normally become more and more fibrotic with time, and also more and more inflammatory with time. So you could imagine that it could reverse the fibrosis and inflammation of aging, probably through its senolytic activity, but also through its ability to inhibit protein synthesis. So in some ways, it shares a lot of properties with rapamycin. But azithromycin is also considered a very safe drug. And I think, people use it for lung infections. There's no reason why we couldn't use it now. And I know that doctors often say that you can't use an antibiotic to cure or treat a viral infection, but they need to read the published literature where it's already been shown by many people that inhibitors of protein synthesis, specifically azithromycin, do inhibit viral replication. I think the problem is that a lot of doctors don't know about that literature, and so they have a kind of knee-jerk response. They don't actually check their facts, and they should read the published literature. Obviously, we have to do clinical trials, but right now, since these are FDA-approved drugs, they could be prescribed off-label. And I think, both those drugs are very safe. Doxycycline is one of the most prescribed drugs worldwide for any indication. It's also used for malaria, for acne rosacea, urinary tract infection. The list goes on because it's such a broad spectrum antibiotic. But also, it's been FDA approved since 1967, so it's over 50 years old. And I think, people trust doxycycline. They know that people can take it for 6 months at a time without major side effects, except with a little stomach upset. So I think, we should do the clinical trials now, but we should also think about prescribing it off-label for viral infections.
Doxycycline is not a fluoroquinone, right?
No.
Good.
They're much more toxic. Doxycycline is one of the tetracyclines.
Yeah.
And
my sister took tetracycline for acne when we were kids. She had to take it for acne, tetracycline. So.
Exactly. But now doxycycline is like the next generation tetracycline. It's got a very similar structure, but it has a longer half-life and a much better absorption. It has 100% absorption and a half-life of about 24 hours. So, and I've heard anecdotal stories of patients in the UK that have been prescribed doxycycline where it had benefit. So, and also of patients in Italy that I'm aware of that it had benefit. So, these are anecdotal stories, but they're from people I know and trust.
So, I keep saying to myself, and maybe I'm just trying to tell myself that I'm better resistant to these types of things than the average 62-year-old. But I keep saying, what's the difference between an older person and a young person? We know that this virus seems to vanquish older people, but isn't it because just their hearts aren't as strong? They're just not functioning well. And it's not about age. It's really about biological age, if you will. That, like, I could go out and I could get on a treadmill and walk at a very high pace for an hour. No big deal. I could even run. I can lift weights for an hour. And so isn't that indicative of your ability to resist these types of diseases? That isn't it your heart that gives out when you're sitting there, you can't get oxygen, your lungs are inflamed and you're breathing and your heart's running, and then boom, you give up. Isn't that what kills people in these types of, in this particular pandemic?
I guess it's the inflammation, but you have to look at also what is the host receptor for COVID-19. Host receptor means the virus binds to a cell, and that cell then internalizes the virus and then replicates the virus. The host receptor, two have been proposed for COVID-19. One is CD26, which is a marker for senescent cells, and the other one is ACE2, angioconverting enzyme 2, which is also increased in senescent cells. So the virus is almost selectively or preferentially targeting senescent cells. So if you think about it from a statistical point of view, it wouldn't be surprising that older people would be more affected, and it might be more lethal in older people and also those cells that are senescent are already making inflammatory mediators because they have increased protein synthesis. What better cell for a virus to target where the machinery is already fine-tuned for making a lot of protein, like the senescent cell? So the virus is actually quite smart in the sense that it's targeting the senescent cells, which make a lot of inflammation, and it's also targeting the cells that are already revved up for protein synthesis. All of this fits very nicely with the idea, and the closest relative of the virus is actually the SARS virus or the SARS-1 virus, and people have shown in young mice that virus is relatively harmless, but in old mice that are 12 to 14 months, it's lethal. So the same age tendency towards people with high or advanced chronological age is also seen in the SARS-1 virus. So it's very similar. So there's a clear association with aging for sure.
But wouldn't I have less? I take rapamycin once every 2 weeks, 6 milligram dose. And we're going to talk about time restricted feeding when we come out of this break. But I do a lot of things that are supposed to reduce the accumulation of senescent cells. I train resistance training 4 to 5 days a week. I sleep well. I'm militant about getting good sleep. I track my sleep. I stop eating at 6 p.m., which is the requisite 3 hours before bedtime that Dr. Dale Bredesen talks about in aging better and reversing Alzheimer's disease. I do all these things. Is it fair for me to think that, okay, I'm 62 on the outside, but on the inside, I'm probably a little bit younger because I don't have that accumulation of senescent cells that my littermate would had they not done all the things I've done so far?
I think that's probably absolutely right because, what we're talking about is, as you said, biological age. And there may be a disconnect between biological age and chronological age in people who have reduced their senescent cells. And also rapamycin has been shown to prevent the onset of senescence.
We're going to take our break now. And when we come back, we're going to talk about time-restricted feeding because that plays into this, because we know time-restricted feeding or intermittent fasting affects the accumulation and eradication of senescent cells. Stay tuned. GHKCU is one of the most effective peptides for rebuilding more youthful skin, reversing skin damage, diminishing wrinkles, and tightening loose skin. I personally use Restoracell with GHKCU every day. It's making an undeniable difference in the quality of my skin. Restoracell is fantastic for all types of skin. Now you can order Restoracell and save 25% when you use the code SHR25. That's SHR25. While you may be diligent in your workouts and your diet, don't neglect what people see first and foremost, and that's your skin. Go to shrnetwork.biz/blue and use code SHR25 today. Remember those rectangular toaster pastries you used to love when you were a kid? Well, Legendary Foods has just made them better. The new cake-style tasty pastry is like nothing you've ever had before. With 20 grams of high-quality protein and less than 1 gram of sugar, you'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary and use the code SHR10 to save 10% off your purchase of tasty pastries. Now available in cookies and cream, red velvet cake, birthday cake, blueberry, strawberry, brown sugar cinnamon, and hot fudge sundae. Go to shrnetwork.biz/legendary and use code SHR10 today. Are you suffering from signs of an unhappy gut? Diversity is the key to healthy, robust inner ecosystem. Body Ecology probiotic liquids are made by fermenting organic seeds, biodynamic brown rice, and chickpeas together to create a diverse culture found nowhere else on Earth. It's the secret to restoring your gut's microbiome for a healthier digestive tract, improved immune function, and longevity. Take 20% off by visiting the website shrnetwork.biz/bodyeco. shrnetwork.biz/bodyeco. That's BODYECO. And using the code SHR20. There have been no new innovations in men's underwear for hundreds of years. That's all about to change with Sheath. Sheath creates 2 separate compartments for your man stuff so it doesn't get smashed into a mound and sweaty and stinky. I won't wear any other underwear now that I've learned about Sheath, and you won't either. Go to shrnetwork.biz/sheath underwear. That's SHEATHUNDERWEAR. Use code SUPERHUMAN to save 20% off. I promise you, once you try a pair of Sheath underwear, you will never wear anything else. There are lots of concerns about food supply today. That's why you need White Oak Pastures. White Oak Pastures will deliver food right to your doorstep. You don't even have to go out and be disappointed by shopping in grocery stores. The finest beef, pork, lamb, duck, and more can be found at White Oak Pastures. And now they even have seafood. And best of all, White Oak Pastures has a negative carbon footprint, which means that you don't have to feel guilty for eating your ribeye. Go to shrnetwork.biz/whiteoak and use the code SUPERHUMAN to save 15% off. Let's talk more about rapamycin for a second.
Shown to inhibit the onset of senescence by Dr. Blagostloni. So I think there's good evidence that it could also reduce IL-6 production by preventing the SASP.
Okay. Now, there are other things that seem to have an effect on senescent cell accumulation, inflammation, and a variety of other things that now have become in vogue when we talk about reducing our biological age. And one of those things is time-restricted feeding or intermittent fasting. Do you think, since these eating strategies, and this could be full-blown keto, which I'm not a big proponent of, eating all that fat. I just don't want to. But I say any diet that produces ketones is a ketogenic diet. It doesn't have to produce 4 millimoles. It could produce 1 millimole. But do you think that these approaches to time-restricted feeding have a potential impact, maybe as a prophylaxis to this particular virus?
Well, I wouldn't doubt it. We'd have to do the clinical trials. But I think, I'm a big fan of ketones in the sense that they can be used to prevent human disease. For example, studies have been done with mice where they artificially induced a heart attack or a stroke, and they gave ketone bodies, and they could prevent the heart attack or the stroke. There are other drugs that you can take, not drugs, but supplements that you can take to mimic the effect of the ketogenesis, which also have been shown to have some anti-aging effects, like acetylcarnitine and lipoic acid. Those also have been shown to prevent heart attack and stroke when they're given as a supplement. They don't behave as senolytics, but they can potentially reduce the inflammation associated with aging, and they can provide additional nutrients to mitochondria under hypoxia. So I think that's part of it, is that ketone bodies will allow cells to undergo mitochondrial metabolism under hypoxia. Also, ketone bodies have been shown, as has acetylcarnitine and lipoic acid, to increase the ability of sperm to swim faster. And sperm have a lot of mitochondria. They have a collar of mitochondria around their tail, and that's what allows them to swim fast.
Interesting.
So, anything that would boost the mitochondria but reduce oxidative stress at the same time, and that's what you have with ketone bodies. The problem is also some cancer cells can use ketone bodies, but I think by and large, if you're in a situation where you have hypoxia, like atherosclerosis, or you have a heart attack or a stroke, I'm surprised that information has never been put into clinical practice, because it could save also a lot of people.
Dr. Dominic D'Agostino at the University of Southern Florida, I don't know if you're familiar with him, but he's been a big proponent of the ketones and ketogenic diet and treating different disorders. And he did an amazing, it wasn't a study, it was just him and a couple guys in the lab, but they used insulin to bring down circulating blood glucose levels, and then used ketones simultaneously. And I think one of the guys who did it, his blood sugar level was down in the 40s, and he was not feeling any issues with hypoglycemia, no shakes, no memory, no blackout, nothing. He was just like nothing happened. And at that point in time, I said to Dr. D'Agostino, I said, why don't we use that for people in diabetic coma instead of giving them glucose, which, it works faster, it hits the brain faster. And, it's amazing. There's so many things, like you're saying. I don't understand why more people aren't paying attention to this and to that. There's so many things out there that people aren't paying attention to at this point in time, and it's really sad. I think
it could alleviate so much human suffering if we just were able to incorporate this knowledge into clinical therapies. The problem is that I guess there's no incentive for clinical trials, but somebody has to put the money into the clinical trials, and we could reap a huge benefit. And ketone bodies, as you know, from fasting are what the brain survives on during fasting. So they're also, and there's a certain clarity of thinking that is associated with fasting that's thought to be from ketone bodies. And part of that can be achieved also with the acetylcarnitine, because essentially what you're doing is your acetylcarnitine is lipid with an acetyl group. So you can't take acetyl-CoA, but you can take acetylcarnitine and it'll have the same effect. It will be a way to activate your mitochondria without causing excess oxidative stress. And in fact, that's what ketone bodies do. They burn with less oxygen, so there's less oxidative stress.
So let's look at senescent cells for just a second. And as you pointed out, there's varying types of senescent cells. Do these strategies turn senescent cells into quiescent cells, or do they allow the body to deal with them through the body's, sanitation system and break them up and carry them out?
So senolytic basically means to lyse senescent cells. And so what azithromycin does is it behaves as a senolytic. It does lyse senescent cells. Some other drugs have been proposed to be senolytics, but they're not selective for senescent cells, whereas azithromycin was selective for senescent cells. So I think you need two things. You need a drug that is a senolytic, but you also need a senolytic that is not going to harm the normal cells. And I think azithromycin fulfills both of those criteria, because you could have a drug that's a senolytic but also lyses normal cells, and that could cause a lot of damage. So you want something that's fairly selective for the senescent cells. And we saw a huge selectivity, and all of that is backed up by existing clinical trials that were done on patients with cystic fibrosis and on patients with idiopathic pulmonary fibrosis, both of which extended their lifespan. And both of those were
Wow.
previously considered to be, lethal diseases. But now people with cystic fibrosis live into their 20s, 30s, and 40s because initially they thought the azithromycin was behaving as an antibiotic, but in the end they saw it's behaving as an antifibrotic. And the same thing is happening today with the patients with COVID-19, because in the end, the reason they can't get the patients off the respirator is because they can't breathe on their own, because their lungs can no longer expand and contract because they don't have the flexibility. The fibrosis has basically turned the lungs into
petrified,
not flexible.
Yeah, like petrified lungs.
Exactly. So that's the problem, is that we're not treating the patients early enough, and I believe that if they were treated sooner, it takes 3 to 5 days for them to get the results potentially from the test. But they should really start right away, because the drug is so inexpensive and so non-toxic. They could start right away, and then in the end, if it's a bacterial pneumonia, it would have been the same treatment anyway. So it's not like knowing that the person was COVID-19 positive is going to give you any additional information. So they should just treat the patients first, and then, if they turn out to be positive, fine. If they turn out to be negative, you treated a bacterial pneumonia. So it wouldn't change your treatment strategy. And in fact, having the test might actually do harm, because the doctor might say, oh, this patient has a viral infection, we're not going to give them azithromycin. So it might actually cloud their thinking, because they don't know that the drug can behave as also an antiviral to inhibit viral replication. So I think people need to act quickly, and they need to prevent people from getting on a respirator. They need to avoid, because in the UK, for example, I think, the rates are that the chances of coming off a respirator with COVID-19 is about 1 in 2, 50%. But I think in the States it might even be lower. It might. I heard a number around 20 to 30% recently. So those are not good odds. So you don't want to get to the respirator stage, and that's all about the fibrosis. So you want to prevent the fibrosis as soon as possible. So we have to get the message out there any way we can.
It's interesting because doctors are thinking of azithromycin. I want to call it a Z-Pak because it's easier for me. They want to look at it simply as an antibiotic, and we've always heard, well, you don't treat viruses with antibiotics, but it obviously has pleiotropic effects, and one of those effects is the inhibit the replication of a virus, and so they need to understand that this is a retrovirus. It uses a reverse transcriptase enzyme, which builds our DNA and puts itself into our DNA and makes the cell a factory for producing the virus. So this is like SARS and HIV, and so these are really nasty viruses. They're very smart.
There's no reason why you'd want to kill the cells that have the virus.
Right. And so, now, I was going to say, so what you're telling me is they don't do this to all cells. They do it just to the senescent cells.
That's what we're thinking based on the receptors. We don't have experimental evidence for that, but I've looked, the literature is very sparse because, all of this happened so quickly in December. And, but there have been some pathology papers on the morphology of the lung, what it looks like before and after, and it doesn't even look like a lung anymore. It's terrible. But I what you said resonates with me about azithromycin, because we've also shown that it's an antibiotic that can be repurposed as an anti-cancer agent to kill cancer stem cells that cause recurrence, metastasis, and drug resistance. And there was a trial that was done for azithro in China in lung cancer patients. And they gave just, I think, a short course of 5 days of azithro, and they nearly doubled survival at 1 year in patients with lung cancer. So, there's a lot of drugs like this where they're approved for one indication, but they may have benefits in many different indications. So the problem is that we have tunnel vision, and we think one drug, one disease, but maybe that drug is already safe. It's already passed a phase 1 clinical trial that says it's safe. That's where the off-label prescribing comes in, that allows physicians with the FDA's approval to do off-label prescribing. So, and physicians in the States do take advantage of that. And that ultimately leads to additional clinical trials. So if somebody sees anecdotal evidence that a drug works in another disease, then they'll do the clinical trial to prove that more thoroughly. But it all starts with a hunch and an anecdotal observation. And so I think, that's why azithromycin eventually became something that was so widely prescribed for patients with cystic fibrosis. It wasn't made for patients, and it's also not having an antibiotic effect in that case. But now it's one of the standard treatments of patients with cystic fibrosis. It's I think it is the number one genetic disease in humans.
Really? I didn't know that.
Yeah. So very unfortunate, but it's good that people have made the connections, and now we need to make the connections further to infectious disease, because infectious disease also induces fibrosis. And in this case, it's a lethal fibrosis that's killing people.
We're going to take our last commercial break. When we come back, I've got a couple more questions. We'll wrap up the interview. We're talking with Dr. Michael Lisanti. He's all the way in the UK and sharing some really great information about how Senolytics, drugs that are being used right now to target aging and help people stay more youthful. It's not about going out and getting a young girlfriend. It's not about even looking better. It's about staving off age-related disease. Well, those drugs may have a place in treating viruses in general, especially the more aggressive ones like retroviruses. Stay tuned. We'll be right back.
Dogs should be powered by fat and protein, not carbs. That's why Visionary Pet makes low-carb, ketogenic dog food for dogs of all breeds and life stages. From kibble to freeze-dried and even low-carb treats, all Visionary Pet recipes are very low-carb, ketogenic, and made with 100% real meat protein. Shop now and use code SHR for 20% off your first order today. Your dog deserves the lifelong benefits of optimal nutrition. Make the switch to Visionary and see why smart dogs eat low-carb.
Never before has a product been so appropriately named as Botanic Tonics Feel Free. This plant-based elixir combines a variety of different effective compounds, all from raw plant materials that at different doses provide you with completely different experiences. A third of a bottle puts you in the zone and makes you very focused and is ideal for a non-stimulating pre-workout. It also has a mild analgesic effect for us older lifters who have soreness and little pains and aches that keep us from training as ferociously as we want. A half a bottle will create a mild euphoric effect that will allow you to forego consuming alcohol but still be socially lubricated and have fun. I have never had a product deliver on its name the way Botanic Tonics Feel Free does, and I won't ever be without it, and you shouldn't either. Go to shrnetwork.biz/feelfree and use the code SHR40 for 40% off your first order. I promise you, you will not be disappointed. P3OM from Bioptimizers is a patented prebiotic and probiotic supplement with Lactobacillus plantarum OM. It has now been upgraded to P3OM 2.0 with the addition of a superfood formulation that makes it 2 times stronger, as well as optimizes L. plantarum's strength, so it's more powerful than ever, which means that not only will it help you completely digest all animal proteins, it also reduces cortisol, causes deep relaxation and better sleep, and reduces stress. Go to shrnetwork.biz/P3-OM today and use the code SHR10 to save 10% off. I would easily say that I am the hugest proponent you will ever meet to doing anything that will improve the quality of my sleep. And that's because sleep is linked to just about every metabolic disorder we see in our population today. One of the easiest things you can do to improve the quality of your sleep is to get a pillow that can be shaped into the exact form factor that allows you to get your best night's sleep. And that is MyPillow. I've been sleeping with MyPillow for a few years now, and I can tell you that when I have to travel and stay in hotels, I don't get a good night's sleep because I don't have MyPillow with me. Right now, you can save up to 60% off off of everything offered to improve the quality of your sleep at shrnetwork.biz/mypillow when you use the code SHR. Or you can call toll-free 800-889-4938. And remember to use code SHR to save up to 60% off of everything at their website.
New Mass Pro Synthogen X2 just upped its own legendary game. To distance itself even further from the rest of the pack, Synthogen X2 now has double the key active ingredients. If you've ever wondered what steroid-like recovery feels like, Synthogen X2 delivers. See why others compare it favorably to powerful bodybuilding drugs at synthogen.com. Mass Pro Synthogen. When you train with it, you'll gain with it.
This is the Superhuman Channel, where we use oxygen for the power of good.
Welcome back. So, Dr. Lisanti, here in the United States, even though we have a lot more latitude to do off-label prescribing, there's a big push right now. There's like a tug of war. I'm sure you're following some of the news here, even though you're in the UK. You know, the NIH says don't. The FDA says don't. Doctors are treating patients. They want to know what tools they can use. What is your message to clinicians right now?
I guess, obviously they need to be conservative, but I think the benefits outweigh the risks in this case because, also to healthcare workers, you could imagine that these drugs could be given prophylactically to healthcare workers, doctors, nurses, anybody who works in the hospital. Many people are probably already taking them because they have acne. It's not that difficult if you go to the dermatologist to get a prescription for acne for doxycycline. So it's not like, and also doxycycline and azithromycin are not associated with tremendous antibiotic resistance. So I think the risks are small if you were to take, for example, a probiotic as well. I think that people take doxycycline for 6 months at a time, and then they take a break of a couple of weeks and they go right back on it. So, we already have a lot of people taking doxycycline for acne. So I don't think the risks are that high, and the doctors can prescribe it because it's perfectly legal, because it's already FDA approved. They just have to use that off-label indication. So right. It's really at the discretion of the prescribing physician.
What about in the UK? They don't have that latitude, right? So what are doctors doing? They know about this.
I don't think they're doing much. I mean, that's the problem. There is a piece of literature I've read about it, and the way they've carved it out, they're talking about the treatment of pneumonia in patients with advanced chronological age, and they're recommending amoxicillin. But if the patient has an allergy to penicillin, and therefore amoxicillin, then you can treat with doxycycline, but only in the patients that are allergic to penicillin. So that doesn't leave much room. And I don't think that the amoxicillin will be as beneficial. So I think, doctors in the United States should take advantage of that right for them to prescribe off-label. It's perfectly legal. And if the patient hasn't had the virus test, which is actually very, very difficult to come by, then also, how do you know it's not just pneumonia? So the legal justification, even though it would be perfectly legal, another justification would be that you didn't have the virus test, and so you don't know that they're virus positive, and you just give it to them for pneumonia.
We could kind of back into a study here. I was just thinking, this is my hey brain. Right now, there's a lot of people out there, as you point out, on doxycycline. And it would be interesting, and when you get admitted to the hospital, they ask you what medications you're on. It would be interesting to see how many people are carriers of the virus and have been on doxycycline at the same time. I bet that could be done in a week.
Exactly. All you'd need to do, and you could even do studies in patients that were asymptomatic. You could take patients that are asymptomatic, that are positive for the virus. You just give them one of the antibiotics for a couple of days, and you look at the virus titer before and after treatment, and you would know in a very short period of time. There are so many patients that are available for treatment. You could do almost instant clinical trials where the fact is that this drug is already FDA approved. It can move right into a phase 2 clinical trial, and this is what they call a window trial, a window of opportunity study, where you have the patient before and after the treatment with the drug, and it could be done in days, and it wouldn't cost a lot of money because the drug is about 10 cents a day for the doxycycline. Also, the azithromycin is off patent. It came off patent in 2017. So there are generic versions of azithromycin as well, not just Z-Pak anymore. So I think, again, clinical trials could be done very quickly, and they could just look at viral titers. But, retrospective studies, the data is already probably there, looking at, what patients got doxycycline, and, you could look at hospital stay, length of hospital stay, whether or not they were intubated and put on a respirator, clinical outcome. All of that data is probably there already. People just need to look at it.
Now, and I want to close the show with this last question. I just want to be clear. Both azithromycin and doxycycline both have the antifibrotic effect, or just the azithromycin?
Well, we have shown it for the azithromycin, but the literature shows that doxycycline inhibits IL-6 production, inhibits protein synthesis, and so it should also inhibit fibrosis. It doesn't behave in our hands as a senolytic, but it does reduce viral replication of the dengue virus. So, for all intents and purposes, I think, inhibitors of protein synthesis would be sufficient in this case but, maybe azithromycin is better. Again, that's why you need to put these drugs into a clinical trial, but you might already have the data there in patients that were recently treated. They just need to look at the records. And if the data is already there, they could draw conclusions pretty quickly. Or, they could use the off-label mechanism. They don't actually need FDA approval for a new indication because they can just use the drugs off-label. So it's really at the discretion of a sympathetic prescribing physician. And if they don't have a test that says the patient is virus positive, then there's no reason. Even they might think it's a bacterial infection. They don't know because they don't have a test. They didn't do the test because I think so few people qualify for the test.
Right.
So we all take an oath to do no harm. In the absence of that knowledge, they could all prescribe it as if it was a bacterial infection. But again, these antibiotics would take care of both. So, in some ways, it might actually be better you didn't have the test, because then they wouldn't.
Then they won't give it to you.
Wouldn't withhold the antibiotic. But but it's because they didn't read the literature and they don't know that these drugs behave as antiviral medications. It's that simple.
This is very, very interesting discussion. I want to thank you so much for coming on the show today. I add you to my list of another reason why I'm proud to be from Brooklyn. So there you go. Brooklyn. I thank you so much for being on the show today, Dr. Lisanti. Great information, and hopefully everybody got something good from it. You take care of yourself.
Thanks, Carl.
Take care.